Hi friends, this is Dr. Ravi Kamapale. I want to bring together a case that I am trying to show the effectiveness of a platform-based approach which we follow in our office, which includes using advanced wound care techniques and processes. And I want to show that case and also record a patient testimonial as to how he felt during this process. So let me go ahead and open up the case of a 44-year-old male who has had history of a right knee surgery on August 13, 2025, and secondary to it becoming stiff, patient ended up needing manipulation under anesthesia around a month later on September 15, 2025, and he ended up then having a problem with the knee surgical wound that they used to open and essentially became infected with cultures showing growth of Staph aureus and E. coli, initially placed on ciproendoxy and later converted to different antibiotic therapy, depending upon sensitivity. And we followed active wound care, debridement, and negative pressure therapy, and prepared the wound bed, but also during the process added an approach wherein we involved remote wound monitoring that helped the patient understand his course and be in touch with the practice. And also we used platelet-rich plasma. 4 of them weekly applications were done and improved the patient's nutrition, and it took us around 9 to 10 weeks to completely take this joint to healing and essentially saving the wound with a significant joint mobility improvement. So what I was wanting to show is an approach of wound care using a remote patient monitoring tool that we are developing here. This is his initial presentation when he presented to the office on October 1st, the initial date of presentation to the office, with, if you see, patient having sloughy necrotic devitalized tissue that essentially ended up needing debridement. And slowly, if you see this picture, the initial picture was taken in the office. We debrided the patient, and at home, when he went, we gave him the application, and he took the picture at home. And basically, over time, then he came back again, and we started taking the picture again in the office. So the way in which we took this is elucidated in this whole process of how we helped him understand his care. And obviously, he came to the office, and we debrided the wound. We take pre and post pictures, and essentially he continued with this approach. If you see, he took this picture in the office and at his home, and he started. If you see on the top here, there's a pictures taken by the patient and pictures taken by the doctor, and these are the pictures that he took at home, which we are able to monitor. If he has any problem, if he calls and asks what is that white material, I could conceivably teach the patient on the remote on a telemedicine tool that is included in the application that we have developed. So let's bring back the doctor's thing too. So basically, as we did this, we ended up also slowly wound bed preparation is being done, and essentially as the wound bed is being prepared, the biofilm is being removed, and essentially we did apply the wound vac, and the wound bed was prepared with improving granulation tissue, and decision was made to start the application of platelet-rich plasma around October 16th, and basically the wound bed then noted to show improvement. If you see over even after the first application, if you see what we did, there's starting to be areas of hypergranulation, and if you see the there was some maceration that was noted around, and the wound bed started improving in size, and also if you see there is increasing granulation, and finally by December 1st week it was almost healed, but this was the picture on December 11th, and this went on to heal. So what we have done is the patient involvement in the care process is the most important aspect in healthcare delivery, and this wound care for this patient involved application of advanced wound care techniques with debridement, exudate management, infection control, and wound vac therapy, but also advanced techniques that took the patient's wound in a patient-centric approach from a necrotic wound to a overall healed wound, wherein the patient is happy, and gave a patient's opinion regarding this in a recording that we can see next. Thank you very much.
Hi, Jasper.
Hey, how are you?
How are you?
Good.
Good. Thank you for coming today. It's one of the final days for your visit here, so thank you for trusting our service and taking care of your problems with the knee wound.
Definitely.
Tell me how your problem started.
So I had a full knee replacement done back in August 13th. Got a lot of stiffness in my joint. My orthopedist recommended a manipulation in mid-September. Post that operation, I did not have good success with the wound healing, and it got, I'm not sure the technical term, it got infected, and came here to see you probably about 2 weeks after that procedure was done.
Why was your initial surgery? You're in the military and you're doing some jumping?
Yeah, so airborne qualified, a lot of rep marches over 20 plus years, and I just wore out all the cartilage in my knee.
And then they did the surgery, it got stiff, and then once it got stiff, they tried to manipulate it, and the suture line kind of became ischemic.
Correct. Yeah.
And when it was dark and black, and they sent over because they were worried about the joint infection. So what we did was we cleaned it out, we did wound vac, and then we kind of got things better. And when we came to the better spot, we cleaned it, and we did oral antibiotics. We did not have to do IV.
Correct.
And it started getting better. It came to a spot, and we did advanced therapy. And how was your experience during that course?
Yeah, so the wound vac was working, and when I came back in, you said that it had gotten good enough to where we could try PRP. Yeah. And we did several four treatments of PRP. And every time that I had it done, I could see a marked improvement within days. I was coming in weekly and doing the procedure, and you walked me through what it meant. You explained what PRP was. For me, it was little to no discomfort having it done, and it was, in my opinion, much better than the wound vac, because I didn't have to carry the bag around with me.
So what we use a technique differently. Normally PRP, they put the gel in the middle and stop it, but whereas we injected it around and locked the PRP in there, and that helps the growth because it brings more growth factors, which I've been promoting since around 2005. I have been using PRP for wound healing, and we did some good work on that. So hopefully they are going to start paying for it. I'm sorry we had to charge you for it. And
definitely worth it though. Definitely
your knee was definitely worth it. Okay, I'm happy for that. So tell me, what other experiences did you have during the office visit or whatever?
Certainly, yeah. So your office showed me how to use an app that you have, and so I would take pictures of the wound, and I could see the progress as it was going through. That it was all kept in there, and at the same time, it allowed me to communicate and connect with you or somebody from your staff if I had any questions. And it was pretty much instantaneous. I could do it any time of day, any time of night, and then as soon as y'all were available, you could contact me back with recommendations or say, hey, you need to come in. Something may be going wrong.
And the whole idea of this process is to be there to help, and any anxiety to be there to help. And what else did we talk about? Nutrition and all
So
that?
yeah, we talked about a whole holistic approach to how wound care is. We talked through different type of metabolic things I could eat. My nutritional value of certain foods I probably shouldn't eat while I'm going through wound treatment, and in general, overall, like, you know, the mental state and how anxiety, because it looked pretty gruesome at first. And you and your staff were very, very helpful.
Yeah, your wife was very initial 1 or 2 visits she came, and after that she let you go.
Yeah, she's like, yeah, you're fine. You'll be fine.
You'll be fine. So she's a tough lady, but she came to the first 2 visits, and after that she let you go, and hopefully she trusts what was going on.
100%.
Yeah. So what would you advise people with wounds with the experience? I know you are an army guy. You do analysis of different things.
Yeah. So I would advise, you know, specifically, you know, maybe even for the military, you know, PRP is definitely successful. There's a lot of research. You and I have talked about a lot of research that's out there. Any type of wound that's having a hard time healing, I would say do some research on your own as an individual. But at the same time, know that this isn't like magic, but it is scientifically proven that it does work.
Yeah, when applied right,
Correct.
and when treated right in the right setup and totally organized, and how do you think patients who go through this need to approach wound care and the whole metabolic side? What was your overall, say, an ex-patient? What would you advise them?
Definitely. So there's definitely a learning curve. If you're trying to do the whole holistic thing instead of just doing potentially just PRP, you need to understand that your body is an organism, and it works. Different parts of the body work together to assist the wound and healing. As far as advising folks, and definitely talk to you, get an opinion what their goals are. And then, as an individual, apply those things that you've learned, and, you know, ensure that you get the best care that you can.
Yeah, I mean, like the happiness of this whole process for me has been saving joint and preventing replacement and keeping the people's joints so that with surgery is prevented. And how worth was the whole journey?
For me, it was, I went initially, you know, when I first had the knee replacement done to the infection, I kind of was pretty pessimistic about what my ability to get movement and range of motion back, and wasn't even sure how my knee was going to heal, how long it was going to heal. But after coming here 2 or 3 times, and then definitely when we started the PRP, my whole mood changed, and, you know, now that I can look at it and it's working.
So, from a dietary perspective, do you think you're going to continue to follow the diet we talked?
Oh, definitely, yeah. So I'm not a huge junk food eater, but my wife is definitely, like, you know, we started adding different nutritional value to all our meals.
So at least you will carry that through. Huh?
Yeah. It's also good for the waistline.
It's good for the waistline and overall energy and demeanor. So any other questions for me?
I don't have any more questions. You and I have had a lot of talks now, and I've thoroughly enjoyed all of that. But no, I really do appreciate everything you and your team here have done for me.
Thank you very much.
I appreciate it.